As Student Nurse Association, we're able to actively partner with schools, put on health clinics, and assist with walks to be able to help people's not only physical health, but mental health.
We also extend our outreach internationally to Guatemala, where we are able to set up health clinics in local schools and install wood-burning stoves to improve the lives of others. As nursing students, we enjoy improving the lives of others, both globally and internationally.
As the chair of the foundation, I'm really proud of a new program called ROSC, Recovery Oriented System of Care. And that looks at each person as more than their symptoms. It looks at how they're going to fit back into the community.
I've been doing this for 45 years, and my purpose is to educate and to teach everyone who isn't an organ donor or who thinks they are to actually register. This is very personal to me, as I lost my sister in 1970 waiting for a kidney, and I lost my son almost 4 years ago waiting for a liver. And I do this with passion.
We in the medical community understand the concept of prevention and how that we have to communicate that to our patients. But in reality, it's very difficult to implement it because it requires a personal responsibility from each one of us in our activities of daily living, from what exercise we do, what do we eat, how much do we eat, do we smoke, we don't smoke. So my work at FAU includes working with students to instill that importance of talking about prevention to our patients, so we can have a generation of physicians that will maintain that communication with our patients and have a better life in the future.
As a lifelong paramedic and registered nurse, I spent my career dealing with trauma patients and seeing how terrible severe trauma can affect people and their families. And so I have a passion for injury prevention. And with my job at St. Mary's Medical Center as the injury prevention specialist, we focus on elder falls prevention, motor vehicle crash prevention, especially distracted driving in the teenage group, as well as teaching folks how to stop severe bleeding. I think that here at St. Mary's in our trauma department, we can make a difference because injuries are preventable, and we sometimes say that trauma is a preventable disease.